All right, let's begin. So, welcome everyone to this webinar. Today we're going to be discussing how to support your employees through pregnancy loss, and more specifically, how we can turn this awareness into action. So I'm very happy to be hosting this webinar with Brenda, who heads up our clinical services. Before we move to introductions, a few housekeeping points, if we may. So firstly, I saw someone ask me, yes, this webinar is recorded. So you will get a recording after the fact that you can watch or share. Just note that if you do want to ask questions, try to avoid any identifiable information. And although the Q&A itself is anonymous, the chat messaging is not. So just a point on that. And if you can't make it, like a couple who have noted, we will be here with a recording tomorrow. So before I introduce myself, I'm going to hand over to Brenda Muchapondwa, who is our resident head of clinical services with bags of experience. Delighted to be doing this webinar with you today, Brenda. Over to you.
Thank you so much, Céline, and thank you everyone for taking this your lunchtime to join us to discuss this very important topic. My name is Céline Brenda Muchapondwa. I'm the head of clinical services. I've been with Fatifa for over 2 years plus, but I've been a nurse for over 18 years, mostly working in women's health. I've done from gynae to fertility, and it's a pleasure to be here today to have this discussion with you and look forward to getting also questions from you. So I hand back to Céline.
Amazing. Thank you, Brenda. I know I've learned so much from Brenda already since I've joined Fertifa, so I'm sure it will be a great hour together. So I'm Céline Crawford. I'm your host for today with Brenda. I run the people and operations function at Fertifa. Like many of us at Fertifa, I have a journey with reproductive health, so I feel very blessed. And I think it's important to share today that I have also been through baby loss. So we'll be sharing some of my experiences through miscarriage as well as having a molar pregnancy. From a work perspective, I've worked in tech startups for the last 10 years, and I have worked as chief people officer. So I am in the unique position to also understand the other side of the coin, which is essentially how we support from an HR perspective our employees. For those of you who are new to Fertifa itself, just to remind you, we're Europe's leading reproductive health benefits provider. We work closely with employers to create more inclusive and accessible workplaces for employees, and today is no different. So we've kind of segmented our conversation into a few sections, but we really want this to be interactive. So if you have questions, feel free to write them in the chat. There will be a time at the end for a Q&A. We will roughly touch on, what pregnancy loss is, what are some of the practical ways to support employees, maybe touching about a policy that can help support that, and just close with the Q&A. So starting, Brenda, with pregnancy loss. So as I say, I think sometimes it's hard to know all the different types of pregnancy loss or what can that look like. So going from my personal experience, I had a miscarriage at 14 weeks. I also had a molar pregnancy. And even though those are, two very different things in themselves, I also know that, there are other types of pregnancy losses. So can you expand on that a little bit and tell us more?
Oh, well, thank you, Céline, and thank you for sharing your experiences with us. So yeah, there are about, I'll say, 9 types of pregnancy losses that can happen, and it all starts quite very early on. So there's the early miscarriage, and that's any pregnancy loss that will happen within 3 months of a pregnancy, so within the 12 months period, 12 weeks period. And this is the most common miscarriage that can happen. Then we go to late miscarriages, which would have been the miscarriage that you would have had, Céline, is the pregnancy loss that happens after 12 weeks in the first trimester, but before the 24-week mark. And there's about 1 in 2% of pregnancies that happen in late miscarriages, end up in late miscarriages. And then we're looking at stillbirth. So that's loss of pregnancy after 24 weeks, and it happens in approximately 0.5% of births in England. And that's when a baby is born and the baby is already died. And then there is complete and incomplete miscarriages. So that's a complete, incomplete or complete miscarriages is when the pregnancy tissues causes or comes away from your womb completely. So the pregnancy detaches itself, and then a person will end up having symptoms like pain, bleeding, and that may lead to needing medical attention. And we can go through how that can be dealt with or how that patient will be looked after. And then missed miscarriages is when a pregnancy stops growing, but there's no symptoms. So the person would have had a pregnancy test, positive pregnancy test, would have had an ultrasound scan and pregnancy noted at the beginning, and then or before the pregnancy scan or gone for a scan and realized that the pregnancy is no longer growing according to the weeks that they should be at that point in time. Um, and can also be noted during antenatal as well, because we know most times in NHS it's quite very difficult to get a scan done in the early stages of a pregnancy. Some will end up having scans around maybe between 6 to 8 weeks. So that's when it will be noted. Then we have a chemical pregnancy. So it's when the pregnancy has started to form, but then there is miscommunication with the chromosomes, which is helps with the production or the continuous of going of a pregnancy. So that means in the pregnancy doesn't continue past 5 weeks. And so people will start having bleeding after I've had tested positive on a pregnancy test at home. And then we have the molar pregnancy, which you mentioned you had, is when a pregnancy doesn't form properly. And so the pregnancy doesn't progress. And so the baby is lost after that. Um, and then there's a recurrent miscarriages, and these are miscarriages that do happen in 1%, and they are very rare, but they do happen where people may have between one now before it was three miscarriages that we used to really concentrate on in saying recurrent miscarriages and intervention being done after three miscarriages. But there has been a lovely campaign that has happened that has allowed patients to be looked after quite very, or a person to be looked after quite very early on, rather than waiting for a second or a third miscarriage to happen. And then we have ectopic pregnancy, is when the pregnancy starts and it forms, but it doesn't pass through the fallopian tubes. It stays there and continuously grows, and that can be an emergency situation that can happen, because ectopic pregnancies are dangerous, because if they do rupture, then a person can need medical attention as quickly as possible to help support them with that. So these are the main pregnancy or baby losses that we do, or women will experience during their childbirth years.
Yes, thank you so much for that, Brenda. I think it's so important to talk about these things because we know that 1 in 4 pregnancies will end in miscarriage, but pregnancy loss is commonly also entitled, the silent tragedy, right? Because people don't talk about it that much. And so even for myself, hearing you talk about the other types of losses was new. I, for example, didn't realize that, mid miscarriage is 1%. So I didn't even realize, that was in the 1%. So I think it's so important to understand the different types so we can best know how to support people who are going through these various challenges, so that we understand that it's not a one size fits all approach, basically. So if you can take us a little bit more, obviously, through the emotional impact, I think some research also shows that 1 in 4 people who go through pregnancy loss will also experience PTSD as a result. And, there's short-term impact, long-term impact. I know you've met and seen so many women going through this, Brenda. So, any insight would be appreciated.
Yeah, so working, and looking after patients going through a miscarriage is a very personal journey for each and every person that we meet. But um, the emotions are all quite closer to each other, because there is the physical part of things where one, when they get pregnant, they will start to obviously experience some some symptoms that women can experience during pregnancy. And when the pregnancy is lost, those symptoms do go away. So that can emotionally then really affect somebody, because then that is a signal to say that the pregnancy is no longer there. And people also go through grieving, because it is a loss, and we all go through grief one point or the other. But this is a personal grief because it's something that one is experiencing from having had been pregnant and now losing the pregnancy. It can also affect relationships. I've worked with patients and partners where relationships have been affected because obviously it's very difficult for the person that is going through the miscarriage and not aware of how they um, how they can cope with it, and also their partners, as equally as they were also going through the pregnancy and expecting to end up having a baby at the end of it, I will also go through the same loss. So that's why it is very important, I think, for people that support people that are going through pregnancy loss to be aware of those losses that people can feel. And then they can also be part of the bereavement part where people are feeling very frightened about what is happening. I do not understand why this has happened to me. Why am I the one in this situation? Um, Confused. Why do I have to be the one having to go through such a terrible situation? And would this ever happen to me again if I decide to go ahead and get pregnant? Guilt. Did I do something for this situation to happen to me? And then unable to make any decisions about what to do moving forward. Once they, during or once the loss has happened, and angry. People do get angry, as I said again, why me? And that anger is very real. And people, or some people, go the other extreme and become very numb because they don't even know how to feel about the situation. And so where we work with people and we can see how people react on a daily basis, and somebody has disclosed that they are going through or they've had a baby loss, I think it's important to watch out for these emotional feelings or expressions that can come out from somebody because they are really struggling at that point in time.
Absolutely. Thank you for sharing that. I mean, I read something the other day that really resonated with me because pregnancy loss is a very special type of grief, right? You're grieving someone you never met. It's very different than actual grief. But you might be grieving plans that you've made. You might be grieving, the potential of, what you wanted in your relationship, etc. So this all really resonates, and especially I think what's important to note as well is that it doesn't matter how long people were with child, even at the earliest stages of pregnancy, people do feel a real connection to, to this baby inside them. And it's not really, the further you go in, or if it's been 2 or 3 weeks or, 14 weeks, I think it all is as impactful from a grief perspective. Do you agree?
I do agree. So I've working in early pregnancy unit. I did look after, a patient in particular who, as you've clearly explained, was in early stage of a pregnancy, and this was during the pandemic. So you can imagine how difficult that would have been for someone to even get access to support. And we were running the early pregnancy unit services, and she called in and she was really distressed. So my job, first and foremost, was to listen to her, give her that room to explain exactly how she was feeling, as same time as reassuring her that I was here and I was going to do all I could to support her during this really stressful time in her life. In the background, I could hear the partner say, "But it was just early." And to
Mm,
her was, no, it was my pregnancy. And early or not, I am losing the pregnancy. So to me, you are really right, Celine. It doesn't matter at what stage of the pregnancy it is. Um, it's for women, it's the baby growing in your tummy and or in your uterus, and it's very, very personal because you feel all the emotions, you feel all the little changes that happen on your body, you feel all the sensations. So it's not a little thing to say, but it was just early, because it's still very, very important that the pregnancy has
absolutely.
been lost.
Absolutely. I think this brings us naturally to our next section, which people always ask me or us as for Tifa, you know, is it, we don't have big budgets, but, we want to support our employees. What are some practical ways that if we decided to do so, we could turn into action tomorrow to be there for our employees and really create that environment? So, the first thing that I'm thinking of is, supporting the workplace by educating managers and educating employees. And, it's very it's very sensitive topic that people avoid sometimes. But I think what's important to note is that, you don't have to have experienced miscarriages or say some deeply insightful thing to be helpful. You just need to be honest and, ask them, what you can do to help. And I think training around that is so important. So, can you tell us a few ways that you think are a positive way to be there for someone during this time? And I think we can go through, I've noted a few things that we can say or not to say, but just from your experience, because that was a great example of the partner there.
Yeah. I think it's important to acknowledge that the person has gone through baby
Yes.
loss. I think it's important. And by saying to somebody, I'm really sorry for your loss, and, allowing that person to, because I think we're quick to say, are you okay? And people don't allow enough time for that person to actually speak. Or even if you see somebody wants to cry, I think most of us that have managed people will walk away quickly because you're faced with a situation that you then don't know how to approach moving forward. But I think, and this conversation shouldn't happen in a wider room with everybody else sitting. I think it's always important to do a one-to-one discussion with that person. And when that person opens up and says, I'm not okay, I think it's always so important to ask them, so how can we help you? How can I help you? Um, and if probably people might not know either at that time because
Yes.
they are also still really struggling to understand what has happened and why this has happened. But I think, if you're managing those people, is I think it would be good to say, okay, is it time that you need offer that time? Because I think most people are really scared of losing their jobs. They are really scared that if I go off for a couple of days, as I said, we went through all those types of miscarriages, but they also need to be managed. So even if somebody has been diagnosed, let's say, for instance, at the early pregnancy unit, to say that you've got an incomplete, for instance, incomplete miscarriage, that now needs to be dealt with because it will not mostly come out on its own. It may need medical attention. It also may lead to surgical intervention as well. So, giving that time for that person to have that procedure done or that time to go through that emotion of losing the pregnancy and also time after that, but also touching in, I think is important to offer a way to actually have these continuous discussions with that
Mm.
person, because I think and agree on that time and also be present at that time. Not to say you are you book an appointment to talk to them on a Tuesday and then on the Tuesday come something has come up. I'm sorry, I can't make it. And even if you can't make it, because we know things do happen, but also try and maybe liaise with somebody else or explain that maybe there may be somebody that can talk to you, or if that's not the case then I can rearrange, but always giving enough time rather than leaving it at the last minute to cancel that appointment with that person. And if maybe once a week, maybe twice a week, but also making sure that they know that there's that support work wise. Is there anything that I can do? Is there anything that we can delegate? And putting the load off them so that they have that time to actually grieve what is happening.
Yeah, I think this is so important what you're saying, because not only is everyone different, but just talking from my personal experience, I know that with my first miscarriage, I just wanted to crawl into a hole and not talk to anyone. And because it was after 12 weeks, I had already told everybody I was pregnant, right? And so there was the element of telling your colleagues, well, untelling your colleagues, which was like a big part of it. Whereas with my second miscarriage, it was I was much more comfortable with it. I was much more stoic about it. And I was actually quite happy to talk to people. And so I guess what I'm saying is what you say is so important about listening to the individuals and be guided by them, because they're also going through that journey of discovery. So, they might say to you, I only want to check in once a week, or they might want to check in more. There won't be a template as to what is the best thing to do, and really try to understand that everyone is different, which is why this topic is so sensitive, because what one person may appreciate, another person might find upsetting, right?
Correct.
So, um, yeah, so I think it's really important to be guided by people. And I think what you say, and I think also what all the websites say, that if people want to go research, there's a lot of good information out there. Acknowledging the grief is very helpful. So for managers that, for this is it's a big, black box, they don't know what to say. Very simply saying, I'm very sorry that you lost your baby,
Yes.
as you said, or this must be a really difficult time for you, or even just saying, I don't know what to say, is just acknowledging that it's a tough situation.
Right.
But this also makes me think about, I guess, what not to say, right? I think people do have the best intentions, don't they? They really do. And I mean, I think they want to lead and say something positive, but even when you say, oh, don't worry, you can always have another, right? So that's one common one that people might say, or oh, it was probably for the best, or it wasn't meant to be, or oh, at least you have other children. Are these things that you hear, Brenda, as well?
Yes, we do. And I think that's at the same time that's being dismissive of that situation that has just happened by saying those things. Or some of the common things I've heard is at least you got pregnant.
Mm,
And I think, as we know, there is quite people do go through challenges with fertility. So one does not even know how that person ended up being pregnant. So even saying at least you got pregnant, you don't know the journey that person has taken to end up being pregnant. So I think avoiding, if you don't have anything to say, like you said earlier on, is best not to say anything at all. And I've heard before, you are young and you can try again. Um, or it wasn't meant to be. How, that those are quite disheartening comments for somebody that's going through so much grief and
yeah.
somebody has just lost something so precious as well.
Absolutely. And I think you bring up a really important point, because at the point where the employee comes to you to tell you that they've been through pregnancy loss, it might have been their first try, it might have been their fifth try, and they've gone through IVF or years of pain. So there will have been, I guess, a silent journey that's been going on in the background. And so it's always important to, be very mindful of that. We've had some really great kind of comments in the Q&A. Someone saying, having been through this myself, I would have liked a follow-up. So whilst my manager was understanding and sorry for my loss when I first told them, there was no follow-up. So asking again later how I was doing. And so it was kind of forgotten about and ignored. So, very sorry that this happened to you. Yeah, so it is very important to make sure that we keep those channels of communications open to give the opportunity for people to share or not to share whatever they want to do, whatever they want to do.
Correct. Yes.
Okay. So I think the second aspect of workplace support, which we see and hear a lot about, is I guess the culture in general, right? So how important it is that the culture is coming from the top. So it's all good and well to say we have these policies or we're doing these things, but making sure that people are living the values and I guess the policies that are in place, and making sure that they're not just aspirational policies, but they're actually practiced. I think it's super important, as well as just as you mentioned, the grief aspect of pregnancy loss. So we'll go into the policies a little bit more. Any other practical ways from your perspective, Brenda, that employers can support their employees going through this?
I think what we have seen, and since the pandemic, there's been quite a lot of support groups that have formed in different companies and encouraged too by the companies themselves. Because I think, as we said before, a miscarriage is a personal journey, but sometimes some people may find value in just still sitting in and also listening to somebody else's journey and knowing that they are not alone in the journey, although the journeys might not be, it might not match, but there's somebody that has also gone through the emotions that they've gone through themselves. um and I think as managers, it's important to have that open door policy where somebody can come and talk to you at any time. I've worked in my past work, jobs where, some managers were very difficult to approach. And even when they knew that one may be going through a tough time, as they were not educated themselves enough in the area, they were not ready to discuss it. So it was almost like, I don't know how to help this person. I really do want to help, but that's an
Yeah.
opportunity for that manager to really look at websites like especially for the topic that we're talking about today. There's organizations like miscarriage miscarriage association groups. There is Tommy's who support people that have gone through pregnancy loss. So, and they've got so many articles that they are available. And it's not just printing an article; it's also reading that article and understanding what that article says for you to
Yeah.
be able to support the person that's going through this loss.
Yeah, and I think what I wanted to add to that is from an employee perspective, naturally the manager is like the first person that you can go to. But it happens sometimes that the manager is not necessarily the most comfortable person that you want to go to. And so it's okay if you go to someone else or share it with someone else, and for that person to have that communication, as long as the communication is happening. I think we need to be flexible in how it's happening, or whether it's HR. And I know now a lot of people have fertility officers or are trying to be more proactive about these things. Do you agree, Brenda, that would be a good idea?
Yes, definitely. That's really a good idea. And I think when you're working in a workplace, you always have somebody that you feel a little bit more
Yes.
closer to. And I think disclosing to that person if whatever you're going through, if you're not able to speak to your manager, is quite good as well. And I would hope that person would also encourage you then to, or be your support base or to go and approach that manager to discuss what you've gone through. So I think a work culture where people are supportive, have got kindness and understanding is really important. And I
Mm-hmm.
think if anything, our mental health is really important. And we need to safeguard that for everybody. And even noticing somebody coming into the office and they are not, they are normally, their normal self, and some people are bubbly, some people are just quiet, but some people go quiet, from quiet to very quiet. And I think it doesn't harm any of us to just approach somebody and say, "Are you okay?
Mm-hmm.
And do you want to talk? And do you want to go out for a drink? Do you want to go out for coffee?" I've had that with my colleagues at work. When I've had my own, hard times where they'll say, "Do you want to go out for a coffee?" And so you are moving away from the working environment,
Yeah.
and going outside somewhere. And my manager is always very supportive of us. She
Mm-hmm.
always check in and offer a day off if you're not feeling well, or offer support whenever needed. And I think that's what we need, and that's what needs to happen more. And I think where people feel more supportive, people will recover more quickly from whatever loss and bereavement that they may be going through, so much more than being ignored and nobody
Yeah.
understanding what they are going through.
Absolutely. Before we move to the next section, which is about writing a pregnancy loss policy, I did want to address the couple of comments in the Q&A. So one question asks, are miscarriages more common in women who have fertility treatments such as IVF?
Um, it does increase it a little bit, but not necessarily. But it does increase these chances of a miscarriage happening, yes.
Okay. And then another question, also more clinical. What sort of intervention can people have if they have recurrent miscarriages? So that's also, I guess the subsection is, what do you say as well when people are having continuous losses? Does this mean they have investigations into why it might have happened more than once?
So yes, they do. And the what we all know in the clinical field is that most miscarriages, unfortunately, none of us know really why they've happened. But people can have different investigations done, either especially if it's happened quite a later stage where tissue can be collected, tissue of the pregnancy. It can be analyzed to check to see why the miscarriage has taken place. But people who've had early miscarriages, there are bloods that can be done, ultrasound scans that can be done as well to check to see, is there some deformity in the womb? Is there um, situations with the fallopian tubes, especially for those that probably will end up having ectopic pregnancy? Why has that happened? Is there something that is causing the pregnancy then not to travel and embed itself into the uterus? Um, when it comes to bloods, you're looking to see if there's any antibodies that may cause miscarriages. Is there any chromosomes defects that may cause miscarriages? Is there also any what they call sticky bloods, where there's clotting factor happening? So there are many tests that can be done, yes. And as I said before, the campaign that was run this year has allowed those tests to be done much earlier than they were being done before, where a person had to wait until they've had 3 miscarriages. So, a person can have 1, 2, 3, and that's hard because one miscarriage itself is very difficult. Having to go then through 3 miscarriages, that just brings somebody to a breaking point. And so, I'm glad that the campaign has happened and has allowed women to be screened quite early than before.
Yes, that's really, really positive. Thank you so much, Brenda. So, talking about pregnancy loss policies, right? So I think they differ widely. We work with a lot of companies, a lot of HR managers to try and advise what is the best way to draft a policy. I think we have some information on our website as well. But one of the things that we really recommend is keeping the policy around loss separate from the fertility policy, because they are seen as different things and almost the feeling of it is quite different. What is your view on this, Brenda?
I totally agree because I think anyone that has gone through pregnancy loss, as I said before, you're going through so much emotions. And one of the things that you do not want to read, first and foremost, is about fertility before you get to actually the stage of pregnancy loss, which may be at the end of that policy, right? Because at the beginning of the policy, you are talking more about how fertility goes and etc. So I think it's important to separate the policies so that it's easier for that person to access as well and be able to know what steps they are available in the company to support them through that loss. Because it's a very is a different subject to fertility for sure. So it needs to be separated indeed.
Yeah, absolutely. I think what's important as well is to have it, as you say, somewhere that's accessible, easily accessible. Um, Another part that's very important is that it's clear. Because I think even if you're saying that you cannot be flexible or you cannot give time off, that it's clear and maybe it's treated on a case by case basis. However, we do recommend giving time off, obviously, because it's such a physical and emotional journey. In your experience chatting to patients, Brenda, how does it vary? Is there, I guess, a recommended time off period that you would suggest? Or again, is it a case by case basis? Is there a minimum that employers should be thinking of when they know somebody has gone through pregnancy loss?
I think if the policy you have your maternity policy where somebody will explain or will come to you and say I'm pregnant, and so you are aware that that person is pregnant, right? So I think with the baby loss policy, I think it needs to really detail from when that person clearly states that if that person ever goes through uh, you know pregnancy loss, it's okay for them to report it as soon as possible, and that will give you enough timeline to be able to sort of like give the person some time off, because as I said, there are different stages of,
Yeah.
of miscarriage. So that's why it's important to open up those channels quite early on so that at least you're aware of, let's say for instance, if it's an early pregnancy miscarriage, somebody may need maybe you know if 2 weeks off, 1 week off, depending, because I know the companies have to think about work and workforce too, but at
Yes.
the same time, the person cannot do their job without being able to, without having a mind that is stable enough to do that job. So I think most cases, in my experiences, people have been given 2 weeks of post the miscarriage, and then after that, there's evaluation on how that person is feeling.
Yeah.
And if, let's say, for instance, the person is still really struggling, and then there is flexible working, or a week, 1 week more of that has been allowed for that person to take. But like we were saying, we've been saying all along, every pregnancy loss is different, and
Yes.
because of different stages of when the pregnancy loss can happen, it's important to bear in mind that you can't just give somebody a week off who has actually gone through stillbirth, because that's really traumatic, and that's not to say that everything else is not traumatic, but
Yes. Yes.
the level of trauma will be different to the one that has just had to deliver a baby that has died.
Absolutely. And it is an ongoing journey, right? So there are
Correct.
some options on the side of the employee. So, for example, in my case, I didn't really have the choice. I had to have surgical intervention both times, right? So, you're going to be in the hospital, you're going to have a recovery time, but some people might opt to, take something and have the miscarriage at home, for example, and they might need different things, in that respect. So I think, as you say, it's so important to at least work around the flexible time, maybe work from anywhere, whatever the company is able to offer. But again, work with the person individually with the guideline of 1 to 2 weeks, which I think has been quite common. That's very helpful. So yes, I think these are very good tips on the pregnancy loss policy. But as we said before, it's all well and nice to have the policy, but then if things are happening, but people are not allowed to do the things that are in the policy, might as well not have the policy at all, right? So, we work with people who don't have a policy but are very supportive, and we also work with people who have a very detailed policy but then don't really let the employees go through that. So I think the most important is to have that communication channel, to be quite clear about how the employee can take time off if necessary, and to have check-ins along the way. Anything else you'd like to add to that?
I think it's always remembering we are human at the end of the day. We are here to support each other. And just
Yeah.
because a person is an employee or doesn't mean that that person is not going through or will go through hard times, and also vice versa, even the person that's managing that person. So I think it's important to, like we said, creating that environment of support, because in listening, I think listening is very important. And as we said, you can have as many policies that you want, but if those policies are not actually actioned properly, then there's no use of having that policy in the first place.
Yeah, absolutely. So this brings us to our next section before we open up for the Q&A. I'm just checking around. I think we've answered everything. There's one question. Do you, i.e. for Tifa, have any resources to help managers deal with colleagues who are going through loss? I think we always have lots of information on our site. We write white papers. And so it's something that we continuously work on top of the links that we mentioned, which is the Miscarriage Association. Am I saying that right? And then Tommy's, right?
Association and Tommy's, yes.
Yeah, okay, great. So, I mean, a little bit about the impact of workplace support. So, why is it important to support? I mean, hopefully it's obvious at this point why it's important to support employees, whether through pregnancy loss or any of the fertility challenges. Obviously, it has a really big impact on productivity, right? So, we see more and more that people are turning to their employers for answers, not only, to the NHS or their partners. And so we have to equip ourselves with information. We have to get more knowledge. But in your view, Brenda, how does supporting people positively through such challenges really help the well-being culture of a company?
Um, I think if I can just speak personally as a person, right, working for Tifa, if I didn't have the support that I receive on a daily basis from yourself, Celine, and from my own manager, I think, I am happy to share anything with my manager and yourself as head of people, HR, because you've opened those doors. And I don't feel like I'm being judged if I come to you and explain what I'm feeling. And I think likewise, a person going through loss does not want to feel that they are being judged for whatever reason, or their loss is not valid, or the way they are feeling is not valid. So I think it's important that we offer that openness and that transparency as much as we can. And where we can't do something as a company, or you can't do something as a company, is important to highlight it to the employees so that they are really aware that yes, you do want to help, but let's say for instance you can only give them 2 weeks because of this reason, but we can work around doing something else in supporting you, or like I say, going into flexible working if need be, or um and I think we saw that even during the pandemic, where people had to work from home. It was not something that people were used to, but we are all now versed to working from home um, and even going into work. So it makes it easier. So I think there's no difference in that. We need to be able to support as much as we can, but mean it, not just as a base of just saying we are here to support. Understanding. I think understanding is important when somebody says, I am still grieving. So, oh, she just wants some time off. And I think people, and sometimes I think we will say things in passing and that person will hear it, and it becomes a very disheartening situation that your own feelings of what you have expressed that you are struggling is not being taken seriously. So I
Yeah.
think, if anything, I will always preach for support because it's really important.
Yeah, absolutely. There's a really interesting question in the Q&A, which I have touched upon a little bit when it's, I guess, recurring miscarriages. Okay, so the question is around if someone is going through recurring miscarriages, there is a compassion fatigue effect, right? Where businesses feel that a miscarriage is normalized for that person. Therefore, the future losses are treated less carefully as a single miscarriage. And this is especially true for early miscarriages. How do we advise businesses on how to handle an employee who may miss up to 6 or 8 weeks of work in a year due to miscarriages? If, for example, they're doing, back-to-back IVF cycles.
I think if the person has explained to you that they are going through an IVF cycle itself takes a toll on a person's body because they are injecting themselves with hormonal medication, and then they have to go through a procedure to retrieve the eggs, and then having to wait for those embryos to form and then put back in the uterus, and the pregnancy, waiting to see if the pregnancy becomes of that cycle. And when they become pregnant, there's still that fear and that anxiety whether that pregnancy will continue. They've had the first miscarriage, so the fear is even more enhanced because then now they're going to go through another cycle of IVF and same feelings, and that takes a toll on the body and anybody, and mentally too. So fatigue is real. Fatigue does happen, and I think is if people do not understand their fertility journey or miscarriage journey, I think it's important to educate. And I think if you are educated enough, you will understand why people may need that amount of time off. And I think we've already touched on some of the procedures that people may need to go through. Like you said, Céline, you had to go through a surgical procedure. So although yes, it's a day's procedure and it's done within a few minutes or an hour, there's still the recovery after that. Because people can also experience bleeding, continuous bleeding that can happen. People can also experience, infection that can happen. So many things can happen post the miscarriage, not just the loss, but everything else that happens that can then impact on their day to day and them coming back to work at a good time. I hope I've answered the question.
Yeah, I think, I guess what you're saying is, there is an opportunity for businesses to educate themselves. And I think with recurrent miscarriages, yes, it's difficult to know what to say, but it's still important to acknowledge the loss and to understand that this person is going through a lot. Now we're moving a bit more into kind of our fertility policies, but we also often tell people around IVF cycles, the employee will need to go to doctors' meetings, they will need to work from home. We also say practical things. They may want a fridge in the office that's separate to put their injectables. And so, there's kind of two things in one here. But I think, yes, again, asking the person what they need is so important. But it is difficult when the situation arises of multiple recurring miscarriages, for sure. So
Correct.
we have a couple more questions. What sort of education do you think will be most impactful for our employees? So I think we've answered a few, but I'll sum up from my side, and then Brenda, do tell me what you think from your side. So I think first of all is recognizing that pregnancy loss happens. It is very common because it is 1 in 4, and if people don't talk about it, it doesn't mean that it's not happening. So that's the first thing. I think the second thing is understanding maybe the different types of miscarriages that then occur because they will need different things. But the most important is listening and having open channels of communications to be guided by the employee as to what they need. And to close, having a policy that is separate for the loss, that outlines what people can ask for in terms of time off, flexible working, room for anywhere, leaving a chunk, I guess, to be tailored to the individual themselves and what they might need. Is there anything you would add to that, Brenda?
No, I think you've summarized it very nicely.
Okay,
Thank
thank
you,
you.
Céline.
So another question in the chat: how do we get people talking about pregnancy loss at work to normalize it and educate people, but without it being triggering for people who have gone through it? This is such a good question. If I may share my personal experience as well, I think when I had my second miscarriage, I was very comfortable. And so we would have lunch together. I would go to lunch, and, I had just mentioned to a group of people that I had had my miscarriage. It was a young workforce, but I I was worried after I mentioned it that, oh, maybe I was revealing too much information and I shouldn't have said it. And it is quite difficult to get this right, for sure. But I guess in your view, how can we normalize it? Something that comes to mind from my experience working in HR is, we always say this in anything that we do, but creating a safe space for these conversations to happen, because they are difficult topics, and they are emotional topics. It's easy to offend without wanting to. So, making sure that people understand, we are all trying to get better. And I think simply having a trigger warning if you are having the chat, or if you have people who are going through losses or are trying for a baby, for them to have a buddy to even just say, oh, we're going to have this conversation at work, or, oh, this person is having a baby shower, or, these are things that we do advise. Is there anything that comes to your mind, Brenda?
Yeah, I think when more of these topics are becoming talked about a lot, we've seen companies as well, reach out to companies like ourselves to do a day of maybe fertility awareness, baby loss awareness talking to the experts and stuff like that. But at the same time, when you even put the announcement that there's going to be an expert coming in to do a talk, is not making it as a mandatory session for everybody to attend. But I think where people can see that the company is allowing experts to come in and discuss areas that they may struggle to get that information, or getting somebody to actually explain what could happen and etc. I think it allows even the person that is going through a loss or has gone through the loss to see that the company does care enough to want to educate even their own staff and themselves in that situation. I think that's what I would add.
Yeah, absolutely. Well, I think these are all our questions. I'm going to give it one more minute. If anyone had another question, do type it in the Q&A box. But hopefully people found this insightful. Thank you so much, Brenda, for your time. I really appreciate having this conversation with you. And so I just wanted to alert people as well that on the 22nd of November, we are having another webinar, Impact of Workplace Support on Fertility Outcomes, with the chair of the British Fertility Society. So we will follow up with a recording and the invite will be in there. I don't think we have any more questions. But yeah, thank you all for attending. And we hope to see you at another webinar and that you took something from it. Thank you very much.
Thank you so much, Céline, for your time as well. Thank you. Thank you, everyone.
Bye.
Bye.